Good afternoon, everyone. Welcome to the fourth and final webinar of the RAKCOMS COVID-19 webinar series 2020. I'm Dr. Vijay Thomas George, Associate Professor in the Department of Surgery, and it is my honor to moderate this final session of this series. This webinar series has been made possible due to the dynamic leadership and encouragement from Professor Gurumadhva Rao, the President, RAK Medical and Health Sciences University, and the support of Professor K.L. Berry, the Dean, the entire faculty of the RAK College of Medical Sciences, and our hardworking Mr. Nasiruddin and the IT department. Over the last 3 webinar sessions, we have been dealing with the nature of COVID-19 infections, its diagnosis, investigations, and medical management. Today, we have 4 more very interesting topics lined up for you. Viewers are requested to please type any questions or doubts that you might have, and we will try to answer as many of them as possible after all the 4 talks are over. The first talk is going to be delivered by Professor Sunil. Professor Sunil is Associate Dean, Examinations and Professor of ENT at RAKCOMS. He did his Master's in ENT from and has taught at the Grant Medical College and Sir J.J. Group of Hospitals, Mumbai, India. His main interest is head and neck cancer surgery. Today he'll be talking about COVID-19 and ENT manifestations. Unfortunately, due to internet issues in India, Dr. Sunil is not able to give the live talk. We will be playing a recording of his talk instead.
Good afternoon, everyone. A warm welcome to this webinar. My name is Dr. Sunil Nichlani, and I'm a professor in ENT at RAK Medical and Health Sciences University. My topic for today is ENT manifestations in COVID. The severe acute respiratory syndrome, coronavirus 2, also called as SARS-CoV-2, was known in December 2019, and it started in Wuhan in China. The World Health Organization, WHO, confirmed it as a pandemic disease on March 11, 2020. As we all know, human SARS-CoV-2 might be transmitted to humans from bats through other mammalian hosts. There is a very potential human-to-human transmission which is suggested, and it's the main source of the virus, and it's spread through respiratory droplets. The incubation time for COVID-19 since the exposure is believed to reach 14 days. Nevertheless, majority of these patients develop COVID-19 disease after 4 or 5 days after being infected. As the topic suggests, the common ENT manifestations, which is seen in ENT practice for COVID-19 infections, is sore throat, dysphagia, voice disorder, hoarseness, stridor. I would like to emphasize over here, in many patients, there is smell dysfunction or anosmia, nasal obstruction, nasal discharge, hearing loss, and otalgia. But soreness of throat is a very common presentation seen in ENT. Apart from ENT, the most important lower respiratory manifestations are fever, dyspnea, and many of these patients might progress to acute respiratory distress syndrome. Out of various research studies, and when we compared the results, on the left-hand side, these are the common ENT symptoms that the patient presented with, namely rhinorrhea in 2.1% of the patients, nasal congestion in 4.1% of the patients, smell affection was seen or anosmia was seen in 6% of the patients, nasal obstruction was seen in 3.4%, Soreness of throat was seen in 11.3%, and tonsil enlargement was seen in 1.3%. So the most commonest presentation in ENT was soreness of throat, and anosmia is a very important, or smell affection is a very important ENT manifestation. This is a quick chart which shows the various symptoms and their presentations in a chart form, with commonly, as I said, soreness of throat to the least common, which was tonsil enlargement. The other symptoms that were seen were headache, smell affection, pharyngeal erythema, nasal congestion, nasal obstruction, running nose or rhinorrhea, and URTI. Non-ENT manifestations are much more common than ENT manifestations in COVID. What are the other non-ENT manifestations? They are namely fever, which is seen in most common presentation in 73.5% of the patients, cough, expectoration, dyspnea or shortness of breathing, hemoptysis, chest pain, and out of the gastrointestinal system, the most common presentation that the patient of COVID presents is diarrhea, is seen in 4.2% of the patients that present. These numbers are out of various research studies on proven COVID-19 infections. This is a brief chart which shows the various symptoms like fever, cough, malaise or fatigue, expectoration, dyspnea or shortness of breath, myalgia, and diarrhea. This chart shows a comparison between non-ENT manifestations and ENT manifestations in a brief study of proven COVID-19 patients. The results of various studies agree that fever and cough are the most dominant symptoms of COVID-19 infections. However, the most common ENT manifestation for COVID-19 was sore throat, that is soreness of throat. The novel COVID-19 virus also is able to cause anosmia in infected patients. I'm emphasizing because many of these patients, the most earliest ENT manifestation can be anosmia or smell dysfunction. There was a research study by Varia, and what he summarized, he performed an objective smell and taste test, and it was performed on 72 patients with positive PCR for COVID-19 and with no previous history of smell and taste dysfunction. They found that out of these 72 patients, 73.6% of these patients had smell or taste dysfunction during the course of the COVID-19 infection. So it's a very early and a very important finding in COVID patients. This finding was also confirmed by another research study by Lycan, and it was a peer-reviewed multi-center study. They also reported in 85.6% of their patients that there was some olfactory dysfunction in proven COVID-19 patients. There are a lot of limitations to these various research studies in today's scenario. Like data collection, analysis, it becomes very difficult. There is incomplete documentation of the manifestations because there is no universal, precise definition of the clinical manifestations. There is a variation in the methods and structure of clinical data collection, and COVID-19 diagnosis is based on RT-PCR test that is not fully sensitive, and many times there is inadequate sample collection which may decrease the test sensitivity. In the field of ENT, there is no available ENT endoscopic or radiological data in the published papers, and there is a lack of universal questionnaire for well-defined COVID-19 manifestations. These are some of the limitations of the various research studies which have been conducted in the recent past. Now coming to the diagnosis, the specific test for SARS-CoV-2 detection is the real-time reverse transcriptase polymerase chain reaction, also called as the RT-PCR test. Now we do is we take a nasopharyngeal or an oropharyngeal swab. These are currently recommended for detecting the SARS-CoV-2 and diagnosing COVID-19. In many patients, A CT scan of the thoracic cavity is taken, which reveals ground glass opacities, infiltrates, and bronchovascular thickening, consolidations. They strongly suggest SARS-CoV-2 infection. It is of great value in individuals with negative RT-PCR. Many patients who come with negative RT-PCR, and if you take a CT scan, and if it shows all these findings, I think the treatment has to be initiated as fast as possible. Take a complete blood count, which might show decreased levels of white blood cells, thrombocytes, decreased number of lymphocytes. The levels of erythrocyte sedimentation rate and C-reactive protein are mainly increased. There are increased levels of D-dimer, serum creatinine, creatinine phosphokinase, prothrombin time, and the liver enzymes. It indicates severe form of COVID-19, and high D-dimer concentration and significant lymphopenia. They are correlated with higher mortality. So these are the investigations that are routinely done in COVID-19 patients. As we all know, there is no available vaccine for SARS-CoV-2 as of now. So what are the potential therapeutic options for COVID-19? There are many agents like remdesivir. Many people have started tocilizumab and chloroquine, hydroxychloroquine. The other potentially useful agents like interferon alpha, cyclosporine, angiotensin converting enzyme 2 inhibitors, glucocorticoids. Apart from supplements of vitamin A, B, C, D, E, selenium, zinc, iron, omega-3, polyunsaturated fatty acids. Now it basically depends on the treating doctor and the findings and the symptoms that the patient presents with. But these are the common therapeutic options which are available today. I'd like to conclude that ENT manifestations for COVID-19 are not as common as fever and cough. Fever and cough are the most common manifestations. It was recommended that considering patients with anosmia without nasal obstruction or running nose as COVID-19 suspicion, and it's recommended initiating testing, basically an RT-PCR, or self-isolation for them. COVID-19 could manifest as an isolated sudden hyposmia or anosmia. Auditory manifestation in the various studies is not reported so commonly, and auditory complication due to coronavirus is very little mentioned in the literature. Otolaryngologists are of a greater risk of being infected with SARS-CoV-2 as they cope with the upper respiratory tract. Therefore, ENT surgeons could be easily infected by the SARS-CoV-2 during performing surgery in COVID-19 patients. These are my references. And for any question and answers, I can be reached on my university email, sunil@rakmhsu.ac.ae. Thank you everyone for a very patient listening. Thank you so much.
Thank you, Professor Sunil, for the very lucid and interesting talk. Reminding our viewers that all the questions and doubts will be answered at the end of all 4 talks. For Dr. Sunil, as he is not live, we will send him all the questions and he will be replying to all the doubts by email. There are a few viewers who said that they cannot hear the sound in our broadcast. We request them to check their sound settings or increase the volume because the sound in some devices may be a bit low. The next lecture will be delivered by Professor Chaitanya Garg. Professor Chaitanya is the co-clinical professor of surgery at RAKCOMS since 2010. He did his master's in surgery at the prestigious Medical College Baroda and has taught at the medical colleges in Baroda and Surat in India. His main interests are medical education and emergency minimal invasive surgery. He will be talking about wound infections and COVID-19. Dr. Chaitanya, please take over.
Thank you, Dr. BG, for the nice introduction. Can you hear me, Dr. BG?
Yes, sir, I can hear you.
And my screen?
Yes, sir.
Okay, so being on the surgical side, we are dealing with this wound infections and COVID-19. So this doesn't mean COVID-19 is causing the wound infection. We will clarify as we go on. So disclosures, none. There is no conflict of interest. So there were few questions to ponder amid the pandemic. So we'll quickly review what are wound infections, who are at risk, how to seek treatment in this scenario, and will telehealth help? What is telehealth? We'll come to that also. So this we teach to our students also. So what are wounds? Today we are focusing only on the skin injury, these external wounds that we see on the skin. So once there is an injury, a break, it initiates a sequence of cellular events and ultimately it causes healing like this. So this is an abrasion. Sometimes you get this when you fall on the road and there is friction and a thin layer of skin is lost. So once you treat, over a few days it will heal. This is the healed one after 21 days. So for this, the question mark, what do we do? Initial, you can visit the hospital, but later on these dressings can be even managed at home without visiting the hospital frequently. Another type of wound, sharp cut. So here what we do, we'll have to rush to the hospital and get it stitched, sutured. We teach our students this part of the basic suturing. So these two images that I showed you, this one and this one, these are acute wounds. So we have types of wounds, acute versus chronic and clean or infected. So acute chronic means based on duration and clean infected based on how much organisms are there inside. So acute wounds, clean wounds, not much of an issue. So acute are short duration, usually heal rapidly with minimal contamination. So very superficial ones like that abrasion will heal on its own. The deep cut, you can stitch it and it will heal rapidly. Chronic wounds, if the wounds don't heal up by 4 weeks, so the wound is still there, not progressing or it has stopped progressing, more than 4 weeks, we call it chronic. And usually, since it remains open, bacteria invades. So infection sets in, like this one. Usually seen in, students will know, a typical diabetic foot. They take a long time to heal. So diabetes is the most common of these. You can have a pressure problem, there's a neuropathy, a blood supply issue, a venous or an arterial, or a low immunity. Out of these, diabetes is the most common. So chronic wounds and diabetic. So just a quick recap, why diabetics are prone. And usually these wounds will be on the foot and ankle area or the leg, the lower limb. Majority are on the foot area. Because this diabetes affects the entire body, every system of the body. So in the foot, it is affecting the blood supply. So there is a healthy blood supply. You can see my red pointer, and a reduced blood supply because of diabetes. Healthy nerves and then damaged nerves because of diabetes. This diabetes is affecting the blood supply, it is affecting the nerve supply, and the sugar which is circulating in the blood itself is a good culture media for the bacteria. So they are prone to wounds. So nerve injury, they don't feel the pain of the injury and blood supply. The nutrients are not delivered to the wound and the wound doesn't heal in time. So because of this diabetes, remember this diabetes means it is usually is a long-standing diabetes. Somebody who is diagnosed as diabetic now will not develop wounds within the next few days or weeks or months. It takes some time. So the basic principles of these diabetic foot care, you have to keep the sugar under control. The fluctuating sugar is more of a problem. So good control. Offloading means remove the pressure on the pressure points of the foot. Like when we are walking, the maximum pressure is on the ball of the toes and the heel. So there are different offloading techniques. If there is a wound over there, there are special casts available. So the pressure gets diverted to the other areas and this starts healing. And the main problem is this frequent wound dressings. And many times hospital visits are needed. So there is a dilemma. Risk factors for chronic wounds. These are established risk factors: diabetes, age, old age, and low immunity because of any reason. And risk factors for a severe COVID-19 disease. This is there in the WHO website also. You see, it's the same. So patients, diabetic patients, elderly or people with low immunity have a risk factor for a chronic wound, but they also have a risk for getting a severe COVID-19 disease. The risk of getting COVID is the same. That has nothing to do with diabetes. But if they get, more likely they will get a severe disease. So there is a problem now. Same chronic wound factors, risk factors, but same here also. So then this creates wound care issues. Is wound care really readily available in the current scenario? The patient might think because of these diabetic foot dressings, they will have to visit hospital frequently. Usually it's once a week. And people are scared. If they visit the hospital, they might get COVID. And one important question, since they are doing the dressings, can the floating coronavirus go into the wound and infect? A few questions in the mind of the patient. So how to address this? There are strategies. Prioritization, patient education, some wound healing interventions, and the telehealth. We'll come to each. So earlier in the diabetic foot management, the goal was aggressive treatment and achieve wound healing as early as possible. But now in the COVID pandemic, things have to be prioritized. The goals are to maintain the wound at a level that it doesn't deteriorate. So patient doesn't land up in complications which might require hospitalization. So just keep it at a manageable level, and better if it can be managed at home. So the goals needs to be changed. Hospitalization policy, every diabetic foot patient need not be hospitalized, only when there are critical issues. So earlier the hospitalization policy was a bit lesser. Even with some mild infections, we could admit them. But now because of the risk of COVID, the policy needs to be changed to triage this patient. So we call this triaging. We can even set up multidisciplinary foot clinics. So like the main hospital, a lot of patients are coming in and out, might be a little higher risk for disease transmission. So there are separate foot clinics where only these diabetic foot dressings are being done. The exposure might be less. And we have COVID-free clinics and hospitals which are officially declared as COVID-free. It is there in the UAE also. Patient education, allay fears of visiting the healthcare facility. The patients when coming to the hospital, they have a fear that corona will get them. But all hospitals have their own streamlining, triaging, isolating, and they take all the precautions. So patient need not be scared. The thing they should understand is, especially if we're talking about the diabetic foot patients, if they don't go to the hospital because of the fear, there are chances the foot will deteriorate, will become severe, and then they will be requiring a hospital admission. That admission will be longer, and then their exposure to other patients will be more. So this needs patient education. On this left side, in any diabetic foot clinic or a wound care clinic, if a patient is COVID negative and just come for a dressing, then this much of PPE is adequate, the one on the left. with a mask. This is a routine medical mask and an eye shield, gloves, and a protective sheet over the dress. On the right side is for a COVID positive patient. The healthcare staff needs to protect themselves also. So for a positive one, you need full gear and preferably N95 mask, eye shield, N95 mask, and a full gown. This was there in the news last month. A lot of hospitals in Dubai have been declared coronavirus free. Abu Dhabi, all private clinics are COVID free now. So gradually, luckily in UAE, all number of cases have gone down. The hospitals now don't have any inpatient who is coronavirus positive. So when this is made aware, then people know that hospitals are safe now. This is today's news, came online yesterday, that UAE has succeeded in countering the COVID-19 outbreak, handled very well by the UAE government. Then there are modified wound healing interventions. So the dressings can be modified. There are special dressings available which will stay longer, will absorb the fluid, and will not stick on the wound. They're a little bit expensive, but in this current scenario, we have to maintain the wound and hopefully make it a healing one without landing into complications. Ensuring proper monitoring. Now here, a bit of telehealth can help. So the patients can even send their pictures on WhatsApp, pictures of the wound, how is it progressing, instead of visiting, or home visits. Someone from the hospital or the clinic visits the patient at home and can even do a dressing change and assess the wound. And then self-care. This is for smaller wounds. The patient themselves will do the dressings and be in touch with their physician through WhatsApp or any other media through which pictures can be sent. This concept of telehealth is already there, but this a lot of things have come up during this pandemic. All of us are doing a lot of Zoom meetings, Google meetings. This telehealth also has come up in a great way, where the physician can interact with the patient either live or you have different versions, only pictures. This has been going around for a while. On WhatsApp, the patients can send pictures to their physician, or even just messaging or record a video and send. And this, the last one is the live teleconsultation. This is live with the physician and the patient. Different variants are there. In this picture, you can see the physician is observing patient on the monitor and can advise. Some hospitals have already started this, some had already started even before the pandemic, but now people are embracing that this is a very useful tool. It minimizes the visits of the patients to the hospital, thereby decreasing the chances of getting the virus. And anyway, diabetics are at increased risk. So this is very useful. So many patients are satisfied, not all. Some still don't accept. So these are the issues. They cannot accept just talking on the monitor. They will be more satisfied and happy when they meet the physician. One advantage is global access. Somebody from other part of the globe can also interact with the patient. You can get an opinion there. Issues are with the technology, because this live teleconsultations needs high bandwidth. The patient should have the apparatus for that, the proper phones, and they should work at that moment. And one more challenge is the insurance, because ultimately this requires payment. Even a teleconsultation is chargeable almost that same level as an in-person visit. So the insurance has to approve it. So the insurance company has to change their rules, which are still in the nascent stage. It's still developing. So the if the insurance takes care, then the acceptance increases. So some tips for the healthcare professionals when we are dealing with these patients. So suppose there is a diabetic patient with a diabetic foot. You can ask the patient to show their feet and then the wound. Can give tips and advice on self-care. During this consultation, their psychological needs can also be addressed too. There is time to talk and discuss. Remember to register these in the patient's file that on such and such date this consultation was done, and make sure the patient knows who to contact if something happens or the food status changes, some complication happens. So where to go, how to go about. So the key points for this chronic wound and COVID-19, the risk factors unfortunately are same. Somebody with the chronic wound has some risk factors, then you can even get a severe COVID-19 disease. And because of this pandemic, earlier there was a call that all elective surgery cases should be stopped. And a lot of restrictions were there on patient mobility. There was fear of corona. Even we didn't know much about corona. Our knowledge has increased over the last few months. So this chronic wound care was compromised. People were scared of going to the hospital to get their wounds addressed to. Hospitals were not sure what to do. All the staff and resources were mobilized towards managing COVID the disease. So this wound care was compromised. But awareness and education is the key. And telemedicine, which is already there, might become a permanent option in the future. So if all the technology is available, and slowly it will get accepted. It will, and AI anyway is getting big time into medicine. So AI will augment into this telemedicine and will integrate together. So when we are fighting this corona, this sword is education. When this corona thing started, we had a lot of false information floating around. No one was sure what is happening. Everyone was having their own interpretation. Slowly, more and more data is coming up. So proper education is needed to fight this corona. Education of the patient, education of the healthcare personnel themselves. Thank you. Over to you, Dr. BG.
Thank you, Professor Chaitanya, for that clear and concise presentation. Our next speaker is Professor Sumant Chavda. He is the co-clinical professor of orthopedics at RAKCOMS. He has done his master's in orthopedic surgery at the Baroda Medical College and has a clinical fellowship in hip and knee arthroplasty from the University of Toronto, Canada. He is a fellow of the International College of Surgeons and is a member of numerous medical professional bodies. He has over 25 years of professional experience at various medical institutions and hospitals across India, UAE, and Canada. He will be talking about safe practices during the COVID pandemic. Dr. Sumant, please.
Thank you, Dr. BG, for the nice introduction. At the beginning, I would also like to thank our President Guru Madhvara, the Dean, the CME committee, and of course, our IT professionals for organizing and supporting these online activities. So today, my talk will be on safe practices. What shall we do to protect ourselves, not only ourselves, but the others as well? So at the beginning, I'd like to tell there's nothing to disclose and there's no conflict of interests. My talk will focus on introductions, the current conditions worldwide, and some of the recommended guidelines by the World Health Organization and the local health authorities. I'm not going to touch the recommendations which are followed at the healthcare institutions, but I'll mainly focus for the general public and the known healthcare situations. And of course, I'll share some of the myths which we should be aware of about the COVID-19. Now, in the previous webinars, lectures, I think enough has been talked about what is COVID, how it spreads, and what is the treatment. So I'll not go into much of the details of that, but I'd like to mention that it's a novel coronavirus which was first detected in the Wuhan city of the Hubei, which is a province in China, during December 2019. And then it rapidly spread across the whole world. The primary mode of transmission, as we all know, is through the respiratory droplets or a direct physical contact with the person who is infected, or through an indirect contact with the contaminated surfaces. There is also a possible role of an airborne transmission. So what are the common symptoms? The most common symptoms we all know is the fever, dry cough, and the tiredness. Fortunately, most of the people who gets an infections have the mild symptoms and they don't require any hospital treatment. Only 20% become seriously ill and may need a hospital treatment. And these are the people who are at risk, such as old age people or who are having an underlying medical conditions. Right? So what shall I do? If you have no symptoms and a possible exposure or close contact with the person who has a COVID, then you must self-quarantine and monitor your symptoms for at least for 14 days. If you develop mild symptoms, you can self-isolate. Now, this can happen usually in the healthcare institutions, but in certain part of the world where there is a limitations in the infrastructure facility or the healthcare facility, it can also be done at home under the guidance and supervisions of the healthcare authorities. If you develop difficulty in the breathings or develop pain in the chest, then obviously you must seek an immediate medical attentions. So as we all know, as of now, there are no approved medicines that have been shown to cure the disease. However, there are several ongoing clinical trials which is happening across the world. Efforts are also ongoing to develop the vaccines in many countries. And very recently, the first vaccine has been launched by the Russia called Sputnik 5. Some of the traditionals or the home remedies which may provide some comfort in alleviating symptoms in the mild cases could be the steam inhalations, saltwater gargles, and the vitamin C supplements. But please know, this remedies does not cure the disease. It just help in alleviating some of the symptoms. At the moment, there are about 21 million cases worldwide, but fortunately, a majority of the cases, as I said, falls into the category of the mild infections. Right, the worst affected countries in the top 5 positions are the US, Brazil, India, Russia, and the South Africa. Fortunately, in the UAE, as Dr. Chaitanya shared the news, which has come into the newspaper, the situation in the UAE is very much under control because of the strict and stringent actions taken by the government of the UAE and the healthcare authorities. So what are the recommended guidelines from the World Health Organizations? Since we don't have any approved drugs at the moment, the best way to keep ourselves safe is to follow this guideline, which will help containing the spread of infections. These guidelines are very basic and simple, but yet very effective in preventing any communicable diseases, including the COVID. So these measures are very important for our personal safety, safety at the workplace, and at the community level. So these are some of the measures which we can take at the personal level. We must regularly clean our hand with the soap and water or alcohol-based hand rub for at least 20 seconds. Must maintain a physical distance of at least 1 meter between yourself and the others. Avoid touching eyes, nose, and mouth. Follow good respiratory hygiene. So cover your mouth and nose when you cough or sneeze. Avoid going to the crowded places and wear a mask if you have to go out. You can stay home and self-isolate if you have minor symptoms, and you should seek the medical attentions if you develop difficulty in the breathing or a chest pain. Last but not the least, we must keep ourselves updated about the latest informations from the trusted sources such as local health authorities and the World Health Organization. And we must stay away from the prevailing myths. Now, regular hand washing, as you all know, is one of the most effective methods to control the spread of any communicable disease, not just the COVID-19, right? So hands should be washed with a plain soap and water for 30-40 seconds, preferably for 1 minute. And it's very important to dry the hands completely after the wash, because damp hands are 1,000 times more likely to spread the bacteria than the dry hands. If you are using hand sanitizers, then you should have at least 60% of the alcohol in that. Now, I think we all are aware about the correct hand washing techniques, which involves the 7 steps. So I think I don't need to go into the details of that. So a proper hand washing can be the most effective method in the control of the spread of this COVID-19s. I have a video to show this technique, but due to the lack of time, I would not play this video. I'm going to share the link at the end of this presentations, so you can watch this video, which is a short video of 1 minute of how to wash your hands correctly. The other important thing which we can always follow at the personal level is maintaining the respiratory hygiene, or what we call the cough etiquette. So we should always cover the mouth and nose with a tissue or the piece of cloth when you cough or sneeze. If you don't have a tissue, then cough into your upper sleeve or the elbow, but try to avoid sneezing or coughing in the hands. By chance, if you do that, wash your hands with the soap and warm water, or use alcohol-based hand sanitizers. And if you are sick, then always put the mask on the face to protect the others. Very important, maintaining the physical distance. Now, you all know the primary mode of transmission of this infection is through the respiratory droplets. So an effective mean of keeping ourselves safe for contacting this virus is maintaining the physical distance of ideally 2 meters, but at least 1 meter is also effective. The other thing we must do is we should avoid a direct contact with an individuals by avoiding the shake hands or giving a hug or kiss. Wearing a mask. Now, currently, there is not enough evidence for or against the use of masks in the healthy individuals in the wider community. This is as per the WHO statement. However, the fabric mask, or what is called a non-medical mask, are advised for the individuals, those who are having no symptoms, but where the COVID-19 is very widespread. It is also recommended to wear when the physical distancing is difficult to achieve. For example, in the places like restaurants or public transport areas or the grocery stores or the malls or the workplaces. The medical mask or the respirator should be reserved for the people who are working in the healthcare institutions. For example, those who are the healthcare workers or the caregivers or the people who have a COVID symptoms, or the persons who are at risk, such as old age people or those who are having the underlying medical conditions. This again video shows how to wear the medical mask. Again, I'm going to share the link for this video. But important thing to remember about putting a mask on the face is you must clean your hand first thoroughly before putting a mask on. You should inspect the mask, whether it is intact and there are no holes. You should orient to the mask. What is the upper part? What is the inside of the mask? Usually the white part is the inside of the mask, and the upper part usually has a metal strip which you can mold around your face. When you want to take the mask off the face, again, you should wash your hands before removing the masks. Now, this picture just want to show you how to wear the mask properly. It should cover entire the face, including the nose, mouth, and the chin. and it should not be loose, it should be snugly fit around the face. Sorry. Maintaining a good health is a good idea to keep ourselves safe, because boosting the immune system can help preventing or contacting the infection. So how you can maintain the good health? You should have a balanced, healthy food with a good amount of the citrus food, green leafy vegetables, nuts and seafoods. Should be physically active, keep yourself hydrated, take adequate rest, and keep calm and composed. And don't take tobacco or do smoking. This will help maintaining the good health and thereby safeguarding ourselves for contacting the infectious organisms. There are a lot of questions about the food handling as well, but currently there is no evidence that the people can catch the COVID from the food or the food packing. This is as per the World Health Organization statement, because the coronavirus cannot multiply in the food. Washing fruits and vegetables with clean and potable water is sufficient, and there is no need to disinfect the food packing materials. But of course, you should properly wash your hands before and after handling the food packages. A thoroughly cooked food for at least 70 degrees Celsius will kill all the harmful viruses and the bacteria, include the COVID-19. So I think we should not be worried much about contacting the virus from the food and food packages. Environment cleaning and disinfections, again, is very much important. The periodic and the regular cleaning of the high-touch surfaces shall be carried out at least once a day. The common high-touch areas are the doorknobs, the window handles or the handrails, bathroom surfaces, toilet and taps, kitchen and food preparations areas, the personal devices such as smartphones and the computer keyboards. The commonly used household disinfectants are the sodium hypochlorite solutions or any other available disinfectants in the market can be good enough to clean the environment and the surrounding areas. Who needs self-quarantine? As I said, anyone who has been in the close contact with someone who has COVID should undergo a self-quarantines. And what are the steps to take while you are under the quarantine? You must stay home for at least 14 days after the last contact. You must maintain at least 1 meter of the distance from the other family members. Allocate a separate room with the bathroom facility possible. We must minimize the visitors. Can assign the separate utensils, bed linen and clothes. And of course, we must encourage hand washing frequently and avoid touching eyes, nose and mouth. And we must monitor the symptoms and inform the health authorities if any symptoms are developed. At the workplace, what are the measures we may take? Now, based on the risk assessment, the workplaces can be categorized as a low exposure risk, or the medium exposure risk, or the high exposure risk. The low exposure risk are the places where there's no frequent or close contact with the general public and the other peoples. The example would be like working from home. The medium exposure risk places are the one where there is a possibility of the frequent or the close contact with the general publics and the others, such as high population density work environment like school, colleges, food markets, bus station, public transports, etc. And the higher exposure risk places are the one where there's a frequent exposure or the close contact with people who are either infected or maybe having COVID-19s. And there is a possibility of the contact with the objects and the surfaces which are possibly contaminated with the viruses. And such places could be the healthcare facilities and the institutions. So some of the key measures which shall be taken at all the workplaces are, again, the personal measures will be the frequent hand washing and disinfections, respiratory hygiene, physical distancing, wearing masks, regular environment cleaning and disinfections, limiting the unnecessary travel, having clear policies and training and education of the staff to increase the awareness, and advising the people to stay home and self-isolate if they develop any symptoms. Some additional measures which might be helpful at the medium risk workplaces is more frequent cleaning and disinfection, at least 2 times a day, and suspecting the activities where physical distancing of at least 1 meter cannot be implemented. If this is not possible, then we must try to have a good ventilations and require the staff to wear the mask or the other protective equipments as needed. Some of the measures which are helpful at the high risk places is an enhanced and regular hand hygienes, use of an appropriate PPE based on the risk involved. I think Dr. Chaitanya has shown you the pictures, right? What kind of the PPEs can be used based on the risks. Training workers in the infection prevention and the control practices, and avoiding assigning the high risk tasks to the workers who have the pre-existing medical conditions. Some of the measures, the other measures which might be helpful is thermal screening. Now, please remember, the thermal screening cannot detect the COVID-19. It detects only the body temperatures or the people who might be having a fever, which could be because of the COVID-19 infections. The good ventilation and air conditioning to provide the fresh and clean air, the mental health and psychological support. And isolation facility if someone fell ill, and arrangement to transfer them to the local health facility. Some of the measures which can help containing the spread at the community level, again to emphasize, which is to be followed by individuals with a good hand hygiene, respiratory hygiene, physical distancing, wearing a mask, avoiding unnecessary travel, limiting visiting the public places, considering postponing and reducing the mass gatherings or the social gatherings, restricting the movements in and out of the high-risk areas and self-quarantine. And last but not least, an appropriate and adequate testing facilities to detect the COVID infections. In the UAE, the government has introduced some smart solutions to detect the cases and to prevent its space. 2 such applications available for download in the UAE, I think we know, is Al-Hosn application. This application is used for contact tracings, and the competent health authorities can identify the people who can transmit the virus and who could be at risk of contacting the virus. These applications are available for download at the Google Play stores and the Apple App stores. The other such application is the virtual doctor for COVID-19. By this application, people can use this service to assess whether the symptoms could be associated with the novel coronavirus infections or not. And this facility is available on the Ministry of Health and Prevention websites. So this could be serves good for limiting the spread of these infections. Now, before I end my talk, I just want to make aware about some of the myths which are circulating in the social media, and we should not fall a prey on it. One of such myth is being able to hold the breath for 10 seconds or more without coughing or feeling discomfort means you're free from COVID. This is not true. And there are also some of the other myths being circulated is that taking a hot bath or rinsing nose with a saline or eating garlic, adding pepper to the meal or soup, drinking alcohol, spraying bleach or other disinfectant over the body, or exposing yourself under the sun and the temperature higher than 25 degrees can protect you or prevent the COVID-19. This is a myth, not true. It also cannot spread through house flies or mosquito bites or the SUS or even 5G mobile network. This was some of the rumors circulating in the social media, so we should not be falling trap on those things. The other myth is COVID-19 does not spread in the hot, humid climate. This is also not true. Hand dryers cannot kill coronavirus. Ultraviolet lamp cannot be used to disinfect hands and skin or other parts of the body. So there are many myths which are circulating in the social media, and we should be aware of this. These are my references. And these are the links for those two videos, which I could not show you on the presentations about the proper technique of the hand washings and how to wear and remove the medical masks. So before I end my talk, I want to salute our frontline workers and the Corona warriors who are fighting against this deadly virus. So stay safe and healthy. Thank you very much for your kind attention.
Thank you, Professor Sumant, for that very clear and simple and practical talk. The UN's Deputy Secretary General, Ms. Amina J. Mohammed, had hosted the COVID Action Platform in April 2020. There it was stated, this infection is not going to disappear. Without science leading us to vaccines, we will get second and third waves of this pandemic. Unless we do produce drugs and vaccines, we are not going to have an exit strategy. That is why the next talk from Professor Ashfaq Hussain is of utmost importance in understanding the way forward out of this pandemic. Professor Ashfaq is the professor and chairperson of the Department of Microbiology and Deputy Director of the Central Research Laboratory at RAKCOMS. His impressive list of qualifications include a Master's in Microbiology from the University of Dhaka, a doctorate from the University of Glasgow in the United Kingdom, and postdoctoral fellowships from the Harvard Medical School and the University of Nebraska in the United States. He has more than 20 years of teaching and research experience in Bangladesh, UK, USA, Saudi Arabia, and UAE. He is the author of many definitive scientific papers in very reputed and high-index journals. He holds a US patent for the technology behind Trizol Max, which is a bacterial RNA isolation kit, and it is marketed globally by Life Technologies, which is a USA biotechnology company. His research interest focuses on pathogen biology and antibiotic resistance mechanisms. It is my honor to invite Dr. Ashfaq to deliver his talk on vaccine development against SARS-CoV-2. Dr. Ashfaq, you can start your presentation.
Okay, thank you, Dr. Thomas, for your kind introduction. And I'd like to start my talk thanking our president, who is always supporting us in research and education, and our dean for organizing this webinar series, and excellent technical support by the IT department, who are like one of them is standing right now in front of me. So thank you all. And with this, I start. So no conflict of interest. This is like general statement. So this is this is from New York Times, the newspaper. They have a vaccine tracker system, so in which you can update every day the development about the vaccine research or what is going on, all this. So according to their latest tracking, they say the 2 vaccines have been approved, and 3 are in phase 3 trials, and there are like 11 in phase 2. So we shall be talking about all these, starting from the approved level and trying to go to backwards a little bit as much as possible, and see what is the current state of vaccine, because the whole world is now waiting for this vaccine, and it is everybody is hoping that when the vaccine will be available, it may help us going back to our normal way of life, which we have been leading before. But it is a matter of time will tell what is the real situation. So these are the different types of vaccines. All like textbook knowledge. All we have. Latest here is the RNA vaccine. In fact, up to the DNA vaccine we have been discussing in the class. RNA vaccine we didn't discuss. So we'll be discussing a little bit, because this has become now new modern technique and giving us a lot of hope. So this is the way I'd like to classify vaccine in this way, depending upon what we are putting on the patient. Are we putting the antigen, or are we giving the gene which will encode the antigen inside the body? So there are two ways of classification. So we have antigen delivery vaccines have the traditional ones like inactivated vaccine and protein vaccine, which is like also subunit vaccine. Also virus-like particles, which is a new development, but we'll be discussing a little bit. This is very interesting and showing a lot of promise. And of course, the newer platforms like gene delivery vaccine, we have like viral vector-based vaccines, DNA vaccines, and of course, our favorite RNA vaccine. So if we go to the next slide, let's see here. Now, what is the important consideration for vaccine preparation? This is very important, and maybe there's so many different vaccine effort is going on in so many different countries. So what are the main considerations they need to have? First is the epitope. So epitope is like, for example, if we have a protein of 100 amino acid long. For example, SARS spike protein of SARS-CoV-2. Although it is a big protein with a lot of amino acids, for the sake of simplicity of discussion, we consider it is a 100 amino acid long protein. Now, the question is against which part of this protein antigen antibody will be developed. The antibodies are developed against the epitope. Epitope means the portion of the antigen which are immunodominant and which are recognized by the immune system. Usually 5, 6 amino acids make an epitope. So, for example, amino acid number 5, 6, 7, 8, 9, 10, 11, that can make an epitope. So another epitope maybe 50 to 56 or maybe 90 to 96. There may be epitopes like this. These we call sequential epitopes because all the amino acids are arranged in sequence. But the protein have another level of structure we call conformation, which comes from folding of the proteins. So, for example, if it is possible that amino acid number 5 may be positively charged, so amino acid number 25 may be negatively charged, so they'll come together. So conformation depends upon overall distribution of positive and negatively charged amino acids. Also, like other interaction and forces between amino acid, like hydrophobic interaction, hydrophilic interaction. All these conformation cumulatively give rise to the development of a conformation. And also, in this case, the protein amino acids which are not directly linked by peptide bond, but they come together due to conformation, they can also form an epitope. This is called conformational epitope or three-dimensional epitope. So now, studies have shown that because a protein in our body doesn't exist as like a string of amino acids in a straight line. They are always enfolded. They have a conformation, and conformational changes are very important in all sorts of receptor ligand interaction, signal transaction in all cases. So when this it is also holds true for antigen. The importance of epitope as in antigens. So in studies have shown that there are more epitopes are conformational epitopes than sequential epitopes. So when heat inactivation is done to prepare a vaccine, conformational epitopes are destroyed, but sequential epitopes are maintained because heating is usually done at 60, 70 degrees centigrade, which is not strong enough to break the peptide bond, but they destroy the conformation. So that is the reason. This is the reason for science always advance as need is there. So as this heating system or this conventional way of making vaccine was not working, so because of the conformational epitopes are getting destroyed, that's why the newer platforms have been developed to where the conformation can be maintained and vaccine can be developed accordingly. So this is one important thing to consider. Types of epitope we have, and for example, there may be a question that what about the we know that very successful vaccine, which like smallpox vaccine, which eradicated disease from the face of the earth, was in fact a heat inactivated vaccine. So again, for example, so this is for some cases heat inactivation works, some cases it doesn't work. Why? Well, it works and why doesn't work? It's a rule of nature. In all pathogens are not same. Their PA and Ts are different. Their interaction with TLR is different. So all this comes into play to determine. So this is what is the summary. Summary is that heat inactivation would not work for all pathogens, whether be it viral or bacterial. Now there's a lot of talk about neutralization of antibody, neutralizing antibody. So again, this is a very important recent finding because I've been doing some research when I was preparing the lecture, and I found a very worrying situation that we all know about antibody to be protective, but in some cases it can be pathogenic also. We'll discuss this when we at the end of the lecture. And also now we have another thing to consider is that you consider a scenario in which a virus infected cell is releasing viruses and antibodies are neutralizing them. It is very good, no problem. But what about if there is a system to destroy the infected cell itself? That is even better because you are eliminating the source of infection or source of release of the virus inside the cell. That is then done by cytotoxic T cell. So whether a vaccine is really leading to neutralizing antibody is fine. At the same time, whether producing cytotoxic T cell also of paramount importance, especially in the case of viral infections. And finally, the memory cell pool. We know that when the infection is there, what is the main theme of vaccination? To generate memory cell pool. So that when vaccination is like inactivated bacteria or virus, to stimulate the immune system, immune response is generated, then immune response goes down, memory cells are still there. So when the real infection comes, they can, so that they can, memory cells will mount a robust and very quick and vigorous response. So bigger the memory cell pool, better is the antigen, better is the vaccine. But again, it varies for some vaccine. Even once it is immunized, it gives lifelong immunity. For others, don't give. Again, why it works for some, why it doesn't work for others? There is a question. The scientists are trying to address. So again, now we talk about vaccine preparation. Now it was like from the time needed was because you can divide like peace time and war time. Peace time and like regular, when there is no regular way, then it takes like about 10 years to 14 years vaccine is needed. But now we should consider that now not like a peacetime situation. We are in war. Coronavirus has declared war against us. So we have to be, during war, there is no time to big decisions, and sometimes we have to do very rapid decision. Sometimes we may have to bypass the system a little bit and develop. So that ultimately, because if we wait 10 years to develop a vaccine, people will be dying, they'll be all finished. So you have to act quickly. So there are many vaccines are being like an unprecedented way, very fast track they are going on. So this we'll be discussing. But again, too much of fast track, again, you should not bypass our ethical consideration too much, because we will discuss the same situation arrived with the Russian vaccine, Sputnik 5. It has been approved, but again, there is a lot of control. We'll come to it. Some scientists resigned because ethics were not followed properly or something. So these are the different vaccine platform we have here. Like, can you see? Cursor is good. Okay, so this is like a heat total heat inactivation platform where all the virus, all the spikes, and everything is there. This one is adenovirus based viral vector based platform. This is the one which, like, this is a plasmid containing the gene encoding the antigen. This is our DNA based platform. This is our RNA based platform where mRNA is encapsulated in a nanoparticle lipid material. So they are the different, diagrammatically they are showing the basis and principles of different vaccine platforms. So if we hear which are the front runners? Front runners, we all know about the Oxford vaccine. This is a viral vector-based vaccine, and the Sinopharm vaccine, which is like Beijing Institute, they are making this inactivated vaccine. In fact, this vaccine is being undergoing phase 3 trial in Abu Dhabi, and Moderna vaccine, which is mRNA-based vaccines. And other front runners we can talk about, like this, Sputnik 5 viral vector vaccine is developed in Russia, and CanSino is a viral vector-based Chinese, which is in China. But these two vaccines are only for limited use. They are not really, they'll be used in military. They're not for general all-purpose use. Also, this vaccine has been approved by the health authority of those countries. Russian health authority approved their vaccine. Chinese government approved it, but this is not approved by the WHO or CDC or global approval. They didn't get it. So that's they call it for limited approval, but for limited use for the military personnel only. So this is the schematic representation of the inactivated vaccine here. We already discussed, just if we for the case of the heating, It will maintain the sequential epitope but destroy the 3D or conformation epitope. That thing has to be considered. Now we go to our genetic vaccines. So there is some. Can you close? Is it necessary? Just a minute. Yeah. So here, like three major types of genetic system-based vaccines are viral vector-based vaccines, DNA vaccines, and RNA vaccines. All have some advantage and disadvantage. The main disadvantage of viral vector vaccine is that you have to grow them in cell culture. So you have to grow them in cell culture. That is one disadvantage. Another disadvantage is that their immunity can be developed against the virus because you are giving an adenovirus or vesicular stomatitis virus. They are the usually given virus where target vaccine antigen is cloned, and then the virus goes inside and infects the cell and delivers the antigen, and immune response is generated. In summary, this is the way that it works. For the DNA, so there is the advantage. The disadvantage is the induction of immunity against the vector itself. For DNA vaccine is that you have a plasmid in which you have inserted the gene which will encode for the antigen. Okay, but there's one problem is that you are inserting a DNA inside your body, which is a foreign. It may get inserted into the chromosome of the host, and it may be going under division along with the cell. So this may be there is no problem yet, but there may be a potential problem in future because we don't know what the DNA will be sitting there. The RNA vaccine don't have these problems because RNA will not get inserted into the chromosome of the host. And it doesn't need any cell culture. It's very rapid and reliable method. Only concern was that their RNA is relatively unstable. We know that DNA is very stable. We have read or heard the stories that even DNA from mummies, which are present in Egyptian the pyramids, those have been cloned. So they're like more than thousands of years there. It is there. Still, DNA is intact, but RNA get degrade very easily, and so this is the problem with that. But now scientists never give up. So they tried all different way how to make RNA stable. So they found out that if you modify the nucleotides, adding different groups, we can make RNA relatively more stable. So that problem is more or less taken care of. So this is the situation here. So again, for viral vector-based vaccine, Oxford vaccine is a viral vaccine, and Russian vaccine and Chinese, they have a vaccine also. The Russian vaccine and Chinese vaccine, in fact, these are approved by the authority of that government for using military people. And Oxford vaccine is a front runner, and it has a high potential of getting accepted and getting phase 3 clearing very easily. So again, we have discussed before that the essential gene is deleted, so they cannot multiply. So what are the vaccine adopted? There are some vaccines are already in the market which are being used based upon the technique. One of the rabies vaccine is based upon this technique, and HIV and Ebola, they are under going efficacy trial, but they are under preparation. It may be coming soon in the market for general use. The Sputnik virus vaccine that I was talking. So in fact, initially when I read about it, they use a very smart system. They use two viral vectors. So I think probably they clone two different genes because we'll be discussing that everybody's talking about the spike protein, S protein. Everybody is targeting this, but studies have shown that if you focus only on spike protein, there will be immunological pressure on this protein and it may undergo mutation. So it is better to have a cocktail of antigen, better than one single antigen. Most probably Russian, not much detail is available. Probably they use these two things, but again they bypass this authority on this ethical issue too much. That one of the scientists nobody WHO nobody is accepting because they don't know what they have done very clearly. They are not telling very clearly, and one of the scientists resigned yesterday. So but again Vietnam is going to buy them, so this is a big issue. So let's leave it there. So DNA and RNA based vaccines, like we know, this is like plasmid having a foreign the one on the right hand side having foreign DNA insert, and this is a mRNA which is encapsulated in a nanoparticle lipid vesicle. for delivery. So these are the two ways this can be made. And for this is one of the most favorite. Everybody is waiting for Moderna to come up with something very meaningful, and many people are believing that it may be a high possibility. So this Moderna vaccine is mRNA-based vaccine. So for mRNA-based vaccine, this is very interesting. For example, you don't have to grow the virus, you don't have to touch the virus, you don't need any cell line because because viral genome sequence is present in the gene bank. So gene bank is a special type of bank. There is no fulus mafi majud. Only the gene is there, only ATCG is there, only DNA and RNA is there. So what they did, what the Chinese people did when they determined the sequence, they put it on the gene bank. And this gene bank has the advantage that for your own bank, you have to have your password to relieve withdraw the money. But this is open. Anybody can go and visit the bank and download, just like you're downloading any paper. So they put the sequence in the bank, and the American, the Moderna guys, they're very smart. They downloaded the sequence, and they used the sequence to make the RNA, and they synthesized the mRNA, and they did nanoparticle encapsulation. Within days, the vaccine was ready for testing. It's very fast. So now the Moderna people, I give credit for another thing they were doing is that because since last few years there was all the talk that a big pandemic is coming. Even they described it as pathogen X, with like huge transmission potential, lot of mortality, a global pandemic, which more or less fits the description of we have for COVID-19 too. So when this was going on, the Moderna people were working with the original SARS-CoV-1, the first one, MERS virus and other viruses, to trying to know more about how a better vaccine can be developed. So they found out that the S protein, which is also present in SARS-CoV-1, when it binds to the receptor, there is some conformational chain. Okay, so conformational chain, as well as receptor ligand interaction, always there is conformational chain. So, but that change made the antigen not so immunogenic. So they found out that if they introduce two mutations in that S protein, it becomes more stable, more immunogenic. So they use this preparedness, or this knowledge, they immediately applied to this new SARS-CoV-2 also. They found that they're the same, so they use like mutant sRNA and spike protein mRNA, and also original unmutated side by side, and they found out that this mutated one is more stable. So they're like one step ahead of everybody. Everybody is working with original S protein. They are using with a mutated and original side by side to see which one is better. So this is very efficient system. Also, we'll be discussing a little bit if the time permits. They're claiming that this. The T helper cells are two types, Th1 and Th2. So if the biasness is towards Th2, it may give what we mentioned briefly about this pathogenic antibody. Antibody can be pathogenic depending upon which way it goes. Too much of Th2 may be pathogenic. So this is again they are claiming that their Th1, Th2 is balanced. We'll come to it. So DNA vaccine, there is no front runner on this vaccine, but there is like a Innova, Pharma, and Osaka University, they're doing it. And we'll discuss that in India, one effort is going on for DNA vaccine. And again, no human vaccine yet on this system, based upon this system. And Zika virus is undergoing testing. It may come in future. So now another very important thing I would like to discuss is like virus-like particle, which we mentioned. Virus-like particle is the virus, only the outside capsid, but no genome. So, and that becomes, those particles can be coated with different antigens. It becomes very efficient system because this says here, in fact, the blue statement is statement from a Nobel laureate. He said that highly dense, highly repetitive proteins on the surface of the viruses trigger the strongest antibody response because many B cells can be linked together. So this is the virus-like particle is just a structure. It allows to cross-link many receptors on the B cell surface. So this is the thing we have. Now what they do is virus-like, they have only the capsid, but this can be coated with like different antigens, so you can have a nice vaccine. So again we go here. Okay, so So SARS-CoV, this effort has already been initiated to have virus particle-based development of this, and why this is specifically very high probability of succeeding that we will get coming to it. This is the thing. Virus particle induces a special type of cell which we did not know before, like long-lasting plasma cells. We know that in antibody immune response, these cells are stimulated by when antigen comes, they are converted into plasma cell. Plasma cell make antibody, then they are converted into memory cell. It is like this. But viral particle, that's a unique thing. They convert plasma cell into long-lasting plasma cells. They'll have a memory cell pool. In addition to, they'll be making long-lasting plasma cells, which will be residing in the bone marrow, and they'll be continuously producing antibody, because we know the memory cell produce antibody when they're stimulated again, when the second real infection comes. But these guys are making continuously. So this is a unique scenario. This makes it very attractive. So this also has a high probability of succeeding. And many people are trying to coat the virus like VLP with like S protein, N protein, other proteins to have in this thing. So these are like different. These are a screenshot showing the like virus-like particle induces long-lived plasma cells, which is a very attractive avenue for further research, and they have whole good promise. Also, like they're like use all the virus vaccine, they're using it. Now, UAE, when we talk about UAE, there's like this Sinopharm Beijing Institute that they made a live inactivated vaccine, and the trial is going, phase 3 trial is going on, and is very happy to it's like it create a lot of enthusiasm, among the people, and UAE constitutes an ideal situation because there are people from so many different nationalities are there, especially phase 3. You have to, in fact, try your vaccine with as many diversity is the key. More diverse, you have better, more about the vaccine. So this is like all targets is already. So it's like huge thing going on. So this is the inactivated vaccine, but it is holding one of the front runners, which may succeed and which may come into use very soon. Now, virus vaccine in India, one is like plasmid DNA-based vaccine is in phase 2, and Bharat Biotech is a very large biotech company. They are making an inactivated vaccine, which is also in phase 2. And Serum Institute is the largest vaccine production facility in the world. It is in Pune. And again, as I said, there's a rush against time. So in fact, they have already started mass production of Oxford vaccine. Though Oxford vaccine is still in phase 3, and it has to be evaluated and reported and approved. But they know that Oxford vaccine is coming. So to cut back on the time, they already started. So they'll be well ahead of others. So when I was searching this Indian this newspaper for this, I found this information in Business Insider India that Bangladesh is also having a COVID vaccine, and they're claiming that by December they will have it, and there's a Globe Biotech. So the Bangladesh, so I searched Globe Biotech, and I contacted and talked to the scientist who is really doing he said they are using the similar technique as mRNA, like Moderna. mRNA-based vaccine, and they said that it's the least expensive, doesn't need cell culture. We need just the know-how and technology, and the guy over there is trained, so he's doing it. So he's doing it like for S protein and N protein, both they are doing. So again, I said, what we'll be doing is so many competition all over the world. How will you compete? But we are not going to compete. We are just to know the world that we are here. We can do something so that we can get subcontract from some big company. Business people, they have their own ideas in. Anyway, so there's the story here. So again, I already mentioned that this Serum Institute is already manufacturing this vaccine, and the price. Moderna said it will be price will be around $31 to $37. Oxford vaccine made in India will be around 237 rupee. That's what they say. So it will be like about like 20-25 dirham, I think, if I calculate it correctly. So again, now this is almost we are near the end of the thing. Our talk.
During the end of time, can we just cut it short if possible?
Okay. So, we say I leave this one then because I have been instructed. So I just go to the last slide where I would like to have. Maybe we can discuss it later. So this. So again, we don't have time to discuss this. So I like, for example, if someone all the talks and about the vaccines and things, what do you think is a good one? If I am giving the authority, what I would do? I would go for VLP, virus-like particle. Why? Because it induces long-lasting plasma cell, and which is like a key thing, like this. But again, which antigen it will be coating with? I'll be coating with like modified S protein because it is more stable, more immunogenic. This is the reason this thing. And modified S protein, that is what we'll be doing. And S protein, it will be like I'll use multiple proteins, S protein as well and protein, because we know that if you have multiple protein in a mixture, the chances of it being more immunogenic and chances of developing mutant against it will be less. So this is the thing, so basically cocktail antigen better than single antigen as a vaccine antigen vaccine. So thank you. So I missed one topic. So anybody interested, you can communicate. I'll like pathogenic, how antibody can be pathogenic. We missed that one. Otherwise, we sort of I was trying to maintain time. So thank you, Dr. Thomas, and thank you everybody, the students, teachers, faculty members who had time to listen and open to suggestion and discussion and communication. If you want to know more, I'll be happy to. So thank you all.
Thank you, Professor Ashfaq, for that
Yeah.
very exhaustive and brilliant presentation. It was very enlightening. Now we come to the question and answer session. I request all the panelists to switch on their microphones and webcams, please.
Okay, so how we go? Okay, exit from here. Hold on.
Okay, so first question is to Dr. Chaitanya.
Yes.
The question is, there are some bluish skin lesions seen on the toes and feet in a COVID patient. What could be the cause of that?
Yes. So they are also known as COVID toes. So this does represent a type of angiopathy, a vascular injury, and it has been recorded in a lot of cases. And it doesn't still specify whether if somebody gets this, will they get a severe COVID disease or not. But it has been observed and that it fades. And some biopsies have been done and they have found COVID particles inside the endothelial cells of these lesions. So it could represent a variant of vascular injury.
Thank you, Dr. Chaitanya. Dr. Sumant, we have a question. There was a patient who did not have any of the commonly listed symptoms of COVID, but was tested positive. And even a month after testing positive, still didn't have any symptoms. The patient is diabetic. Is there any relationship to being asymptomatic and diabetic? And the patient was not exposed to any known positive COVID patients. Any comments?
Yeah, now in this scenario, there could be two possibilities. One, there could be an error in the testing because there are likely false negative and the false positive tests which can happen. So it is very unlikely a patient having tested positive has remained asymptomatic for almost a month, and that too a high risk patient. So it is very, very unlikely. So in this scenario, one thing we should do is we should retest patient, and still if it is tested positive, I think it should be under the isolations, under the health physicians care, because it's very unlikely that patients having positively tested remaining asymptomatic for almost a month.
Right. Thank you, Dr. Sumant. Next question to Dr. Ashfaq. Do you think the vaccine which has just come out from Russia will be useful in UAE? And the second part is, since the virus mutates quite a bit, do we need to have designer vaccines for individuals?
Well, Russian vaccine is already in some controversy, I tried to mention, but that approach was very smart I think eventually if they clear up the back issues, I think it will be a very good vaccine chances because they're using two vectors. They're probably using a cocktail of antigen, which will be we know that we all know that is better than single one. So this is one thing. What is the designer vaccine? It is possible if you have like billions of dollars, you can. It is possible. It is possible even. It is possible to even take your blood and then you have a dendritic cell and stimulate them and put it back. Some case it is being done. So it is possible. If you have anything is possible. Science is there, but it's for mass scale. It is sort of impossible. But individually, it is possible. Is being done for other diseases, so it should be possible here. This all we know this about this they call it checkpoint inhibitors and all these. They're like designer based. So it's possible, individual based.
Yes. Thank you. Thank you, sir. Dr. Chaitanya, does COVID-19 have any effect on surgical wounds, like in wound healing, especially in thoracotomies or laparotomies? And is the surgical outcome affected if a patient has COVID-19?
Yeah, so this coronavirus needs specific cells to latch onto and then multiply. So wound conceptually, yes, through the wound, it looks like it can go inside and multiply, but it has no cells to latch onto. The cells in the GI tract and respiratory tract, yes. So through a wound, till date, COVID infection has not been documented through wounds. So when you are operating or in cases who have sustained injury, you have to be careful as a general measure so that they don't get COVID through the air route, the oropharynx or the nasopharynx. Or if a patient is COVID positive and you have to operate, even a diabetic, would you want to do some debridement or a laparotomy and a COVID-19 positive, then you have to take all those precautions. But because this can be an aerosol generating procedure also, the intubation, so all those precautions is to be taken a separate operation theater with all the PPE, limiting the movement of people in and around. And once finished, you have to again clean up and sanitize the operation theater and take all the precautions. On the surgical side, we used to take such precautions for HIV positive cases, something similar to that. Some more precautions because this virus is highly contagious once in the air.
Right. Thank you, sir. Dr. Sumant, we have talked about different types of masks. So one of the parents is concerned, which is the most suitable masks which can be used for the students in schools, which needs to be worn the whole day?
Yeah, as I mentioned in my talk, actually the WHO recommends using the non-medical mask for the general populations, where physical distancing is not possible to achieve. Right, so this is suitable for all the people in general, so, including the children in the WHO. Now, WHO has stated that the fabric mask should have at least 3 layers. The inside layer should be made up of the hydrophilic material, which can absorb the moistures and the droplets. The middle layer should have some kind of the filter which can prevent the transmissions of the germs. And the outermost layer should be made up of hydrophobic material, which can repel the droplets and the moistures. So wearing a fabric mask will be more comfortable because the inner layer is made up of the hydrophilic material, so which can absorb your sweats and even some of the moistures. So this is what is recommended by the WHO. But the people are using the medical mask as well. Maybe a little more uncomfortable for the long term. The other advantage of using the non-medical mask is it's reusable. I mean, you can wash and you can use it again. I think this answers the questions.
Yes, thank you, sir. Dr. Ashfaq, the last question, because of lack of time, we cannot take all the questions. Do you expect any side effects for these vaccines which are going to come up?
I think it will not be. Sometimes vaccines have some side effects. Some kids get fever and some, something like this, but nothing unusual. We don't expect anything which we don't see in other vaccines. Usually, it will not be there. In fact, even mRNA-based vaccine, it will be much more milder. So although we are putting big hope on mRNA-based vaccine, but there is no single vaccine yet on this platform yet. So it has to be determined. Time will tell, but theoretically, it is should not have any severe side effects or consequences. So Dr. Vidi,
Right,
if they can they send me the question? How will we know that? Who asked and
yes,
what are the questions? Is
yes,
there any
yes, we
way?
can.
You can tell them to write to us or something.
Yes, yes. Anyway, we are running short of time, so we will stop with the questions now. So we have come to the end of this webinar. I want to thank all the panelists, Dr. Sunil, Dr. Chaitanya, Dr. Sumant, and Dr. Ashfaq for this very enlightening and very brilliant presentations. We hope all of you enjoyed listening to it as much as we enjoyed bringing it to you. Before I conclude, I would once again like to express our gratitude to Professor Guru Madhav Rao, our President, Professor K.L. Bairi, our Dean, the entire faculty of RAKCOMS for their encouragement and support. And I would like to thank especially Professor Chaitanya, who is the chairman of the CME committee, and the CME committee members for their leadership. And once again, thanks to Mr. Nasiruddin and the very hardworking and helpful IT support staff
Very good.
for
Sure.
their excellent arrangements. And last but not least, I would like to thank all of you, my dear viewers, for your patient listening and for taking time off to support us. Don't get worried about the hard times and the challenges. Highlight our victories because it is our victories which will inspire, motivate, and encourage other people to be positive and look forward to the rainbow at the end of the thunderstorm. Thank you to everyone. Wish all of you a very good evening and stay safe.
Thank you. Thanks.
Thank you. Thank you, Dr. BG. Thank you. Thank you, everyone. Thank you.
Thank you.